It is. So, World Universal Health Coverage Day. The day comes as the rollout and implementation of the National Health Insurance Act, which is aimed at ensuring access to health for all South Africans, remains high on the agenda. Joining us in studio, we're very lucky to have the Minister of Health, Dr. Zweli Mkhize, to talk to us about it. Good to have you. Thanks so much for coming in.
Morning, Leanne, and all the viewers.
So, we talk about World Universal Health Coverage Day. For South Africa, this must have a special emphasis and meaning, particularly where we find ourselves as a country. Talk to us about this.
This Universal Health Coverage Day is a special day which was determined by the heads of states under the auspices of the United Nations. You recall that in the past few months, in September, we had a United Nations General Assembly where heads of states had to come and pledge their support for universal health coverage. And so the theme this year is Keep the Promise. And it's really all about saying every country needs to move towards ensuring that there is universal health coverage, which means equal access to health services by all citizens whenever they need it, wherever they need it, and to the extent to which they need it, based not on whether they can pay for it and that they should not suffer because they are unable to pay for it. And therefore, it's one of the issues that are very important in terms of ensuring equality and social justice across all the countries in the world. And so the Universal Health Coverage Day is a day to send a message to everyone to say this is a program not for ministers or departments of health, but it's a program for all countries to embrace.
Yeah, if we look at our particular case right now, our health sector is in a very, very difficult position because, reports and studies into it, and it doesn't need to be reports and studies, you just have to speak to people that use the healthcare sector every single day, that there's mismanagement, there's underfunding, deteriorating infrastructure. All of these things are adding to the woes of South Africans when it comes to medical care. And we find ourselves in a very difficult position where the few do get healthcare at a very high cost, paying medical aids, and those that rely on the government are honestly getting a very, very difficult time there. So, how do we balance that? And I know that the NHI is one way of doing it, but people are worried about that as well.
Yes. You've actually just identified the key issues. Those who get the health care, and they can get the health care that they would consider to be best, but it's actually very expensive and there are too few. Those who receive the health care from public institutions, it's actually under pressure, underfunded and so on. So the issue is, when we looked at the entire expenditure on health in the whole country, we believe that it is adequate, both in terms of global standards as well as in terms of the available resources in the country. It's just that inside the health sector is badly distributed, it's badly coordinated. So the same amount of resources can be reorganized in such a way that we are able to give the best health care for everyone with good and equal access to quality health care for all. So what we really need to do is to do two things. On the one side, we need an approach that basically transforms all the health services and changes all the problems, all the weaknesses that you're talking about: shortage of staff, shortage of medicine, bad management, and also poor infrastructure, long queues, bad food, bad linen. All of that needs to be changed, to be transformed, to give the kind of quality care that when you go into the hospital, you should find shorter queues, should find more caring staff, you should find less stressed staff that are available in good numbers, and therefore medication being available and all of that. Now, good infrastructure. On the other side, we're saying that you need to pool the funds together. All the funds that have been contributed by individuals and the funds that are being contributed by the state, we pull it together and therefore create a system which we have seen in many other countries where you use that fund to purchase the services for everyone. And therefore, what determines what treatment you get is the nature of your illness. It is not whether you can pay for it. It's estimated by the United Nations that almost 40% of the population in the world has to actually face what is called catastrophic payment, which is a cost that is a decision. So when somebody to decide whether they've got to buy meal or they take the child to go to get treatment. So we need to make sure that we remove the problem of people having to choose whether they must go and have food or whether they get health. So the balancing of that is what we believe is a system that creates cross-subsidization. Those who have got means subsidize those who don't have. Those who are younger subsidize those who are older, who are sicker. And with time, they will also be in the same position where they're no longer able to contribute, but the system is so funded that it's continuously able to look after those.
Who runs the system? Will the government run a system?
Well, you create an entity. Basically, you create an entity which is more or less a standalone entity that is what we call Schedule 3 entity that focuses on the budget that's been given and the mandate that they've been given. They don't do anything else. They just focus on that, and it has a strong checks and balances wherein people can complain about it. It's got tribunals that will determine whether people have been treated fairly or not. And then we've also, on top of that, President has said we must create a health sector anti-corruption forum, which basically brings in the police, the Special Investigation Unit, the NPA, the prosecuting agency, the civil society, to oversee all the complaints about corruptions and reported corruptions, so that you can uproot corruption. Now, we believe that we need to start that process now, long before we actually create this entity, so that everybody knows that we will not tolerate corruption under NHI.
Well, I mean, it's with all due respect, Minister, it's hard and I'm sure you can relate to what I'm about to say. It's very hard at this point to trust state-owned entities, to trust where you say that this will be managed as an independent entity, because, we look at our airline, we look at Eskom, we look at PRASA, we look at all of these things that have the same mandate, where they are going to operate as an independent entity with no interference from anyone. But the reality is there is interference, there is corruption. These state-owned entities are falling apart. Now, our healthcare this is a very fragile thing. Already we can't look at it and say that it's in a good condition, but there is private healthcare, and the worry is that all of it is going to now crumble. How do we allay fears around that?
Well, I don't believe that it's correct to say it will crumble. We basically are saying that when we purchase the health services, we will be purchasing from public and private, depending on accreditation, depending on whether people comply with the requirements, depending on whether they will accept the determined prices, because part of the problem is the prices are very high, unnecessarily so in the private sector. But I think our people are correct. When you complain about corruption, they're not imagining things.
Yeah.
When they say that there are issues, we're out there. You've got the Zondo Commission talk about state capture. You've got people who are misbehaving. You've got mismanagement and so on. And where I agree with those who raise this problem is the fact that we have to demonstrate. Firstly, consequence management. When people misbehave, there must be consequences.
Yeah.
When people mismanage, there must be consequences. There's no way you can run the hospitals there in the NHI, in the way we're running hospitals, the public hospitals today. It's got to be completely different. You've got to give enough authority for the local management to be able to run the hospitals. And excuse me. And when you do so, you need to then make sure that they can run their budget, they can deal with their staff. They must take responsibility for the performance of their own hospital. Everywhere we've seen, the hospitals have to run like this. So we have to review the delegations. We have to actually avoid a situation where a provincial office has got the mandate to go and fix a window in a hospital. The local management must be able to take responsibility for that.
Yeah.
You need to also train. We've got a program which we call the Quality Improvement Plan that is actually training everyone from attitudes to cleanliness of linen to cleanliness of passages and floors and all of that.
And attitudes of staff as well.
Attitudes of staff, indeed.
Many people complain about that.
Indeed. Attitude of staff is what cures or heals people faster than the medication. When you walk into the clinic or a hospital, the nurse or the security guard who smiles at you and is very helpful and supportive to you is the one that makes you feel better already before you even meet the doctor. So by the time the specialist comes to give you treatment, you're already feeling much better because of the care that you receive. It's care. It's care. It's not just medicines and injections. It's care. It's the human touch, and that's what we have to really invest a lot on. And we discussing this with the unions, we're discussing with the professional associations. We have to actually strengthen the caring ethos, the more the humane touch to caring. That's most important, more than all the other things. It's caring. Attitudes is also strong management. That also needs to be worked on.
Minister, you speak a good game because you speak sense, you make sense, and everything you're saying is right. And we cannot be living in a country where, I'm not sure what the percentages are, but I mean, last time I read it was, not even 20% of the entire population here in South Africa use private, and the rest of the population is dependent.
16%.
16, there you go, 16%.
About 9 million people.
And the rest of South Africans have to share the minimal facilities that we do have, which is it is not right, because that shows you the disparity which we cannot have. But the reality is that this needs to be done in a proper way. NHI, I have to, I know, go to the news headlines, but where are we with NHI? I mean, is this going to happen? I know there was commentary about it, and that was open to public opinion. Where are we at now? What is the way forward in terms of timelines? Well,
timelines are that we're going through hearings we need an NHI bill to be passed. It gives us a framework within which we can start creating the NHI. So at some point in the latter part of next year, we should be able to get it through both National Assembly and the National Council of Provinces. And beyond that point, between now and the 2025, we're setting up the structure. We're fixing what is wrong with the public health. It has to happen together. It's the same. Each one is a side of the same coin, because you have to change the health services, improve them on the basis of the standards that the NHI requires. That is the package that we have to take. And so up to 2025, we're actually fixing the structures and also fixing what is wrong with the system. We would like to convince our people with the change that they will experience on the ground that in fact that the system is going to be different. We want our people to trust the system. They must come to the public health service as a first choice, not because this is the only thing that's available, but because it's the best that they would like to be part of. And so we really want to move in that direction. I don't think that the negative things that have happened must discourage us from believing that we can actually achieve it. South Africa has been able to achieve greater things before, and we believe that is one of those things that are part of taking forward the issue of democracy and equality and social justice into the future. So we must work together on this one.
Minister, we have to leave it there, but we thank you for your time. Thanks for talking to us. The background behind today's interview, of course, is World Universal Health Coverage Day, and all of this coming on the back of South Africa's rollout of the National Health Insurance, and talking to that where we're at, and also how South Africans are desperate for adequate health care for all. Our Health Minister, Dr. Zweli Mkhize, always a pleasure. Thanks for being with us. All right, I know it's late, but let's just bring you up to speed with some of the stories that are making our news headlines. Sakina, it's over to you.